I heard my big sister talking to her friends about how she was bleeding because she had her period this morning. That sounds so scary. I see. Well, if you don't really understand what a period is, then it can sound pretty scary. But the most important thing to know is that periods are a natural and healthy part of every girl's life. But this shouldn't get in your way of exercising, having fun, or enjoying yourself, so there's nothing to worry about or be afraid of. Most girls will get their first period anytime between the ages of 10 and 15. Now, as you grow older, your body also goes through changes, and having period is a normal part of this change. When you have a period, initially, you may only have a bit of blood from your vagina. For the first 1 to 2 years after a girl starts her period, it may not come regularly, but after this, a girl's period should be coming around once every 4 to 5 weeks, accompanied by regular bleeding, which is normally a couple of tablespoons of blood over 3 to 5 days. Well, that doesn't sound as scary as I thought, but I'm still worried. Does it hurt? You might feel a bit of cramp during your period, especially in the first few days, which can be uncomfortable, but you can use a warm heating pad on your belly and this will reduce the pain. You can also have mild painkillers advised by your doctor. Sometimes, girls can have PMS, which is premenstrual syndrome, before or during your periods, and it comes with moodiness, sadness, anxiety, bloating, and even acne. All these are symptoms, but they normally go away after the first few days. Okay, that doesn't sound as bad as I thought, but how long will I have a period for? Generally, women stop having their periods around age 45 to 55 years and while they are pregnant. Pregnant? What does a period have to do with pregnancy? Well, how about we look at it in science a bit more to help you understand? A period is a part of something called the menstrual cycle, which is an important process our body goes through over 21 to 35 days in order to have babies. Okay, cool. I think I get it. What if? You should never be afraid to ask about anything to do with your periods. Well, I was just wondering if there's something I should be worried about. No, unless you see these things or you experience these things. You have heavy bleeding where you have to change pads too often, or your period lasts longer than a week, or you have bleeding in between periods, or your periods do not come regularly, or you have a strong pain that is not helped by painkiller medicines, or you have severe PMS, which I said is the premenstrual syndrome, that gets in the way of your studies, work, or hobbies. If you have any of these things, you should go and see your doctor to get help. Thanks, Next. I'm not scared anymore. You've made me feel way less nervous about having my first period. I'm so glad to hear that. Remember, you can always talk to the healthcare professional, a female grown-up, or your big sister if you have any questions.